Malaria remains one of the world's most pressing public health threats, a leading cause of sickness and death in Africa. Nigeria carries the heaviest burden globally, accounting for 27% of malaria cases and 37% of deaths. Children under 5 and pregnant women are the most vulnerable. To tackle this, the Ondo State Government, in partnership with the National Malaria Elimination Program and Malaria Consortium, launched a mass distribution of insecticide-treated nets across the 18 local government areas of the state. Field workers in malaria-branded uniforms move door to door, registering families and handing out nets. The campaign manager for the distribution in Ondo State, Abiodun Ojo, says progress has been steady, stressing that insecticide-treated nets remain one of the most effective tools for preventing malaria.
Before distribution, we have a training of the various campaign personnel, which help in distributing this net across all the 2 or 3 wards in the state. And after the training, there was also another level of training for the people at the LGA level, because we want this net to reach also the grassroots. So basically, it's 8-day distribution to cover 1.2 million households with 3.6 million nets. When you connect the nets, you have to hear it for 24 hours under the shade. After hearing it for 24 hours, then you now bring it to your bed space, hang it to your bed space. You put it in the 4 cardinal points of your bed, and when you want to sleep under it, you ensure that you tuck it in.
The usage of the mosquito nets, aside from the prevention of malaria, which claims so many lives globally, especially for pregnant women and children, you understand? So it will also reduce the transmission of that infection, of this disease entity.
Residents welcome the exercise, calling it a crucial step in protecting households against malaria.
Thanks so much to the government. We really appreciate for the gift because it's free. So because we want to go and buy it now, it's almost 4,000 or 5,000 naira that they are selling it. But they give us free of charge that we should be using it.
However, reports suggest that some of the free nets are being sold illegally. Malaria Consortium's Demand Creation Advisor Dr. Olubumi Ojelade explains that some households inflate their family size to collect extra nets, which they later sell.
It's unfortunate that this is happening. We want people at home to understand that, number one, insecticide-treated nets, hens, are meant to prevent us from getting malaria. And that malaria is still a serious matter in Nigeria and serious matter in Ondo State. If you bring 10 people together in Ondo State, you have at least 3 of them having malaria. And not everybody is seeking the right treatment for malaria. If you know this is important, you won't collect something that will prevent you from disease, and then the next thing is that you're going to try to sell it. And then we also see people using them to cover gardens. Gardens are not infected by malaria. So there is no reason why we should cover our gardens with nets. So what we have been doing is continuous engagement with the community members, like just like what we are doing now. Please, people at home, have this understanding. The net is meant to prevent you from malaria. Don't sell and don't buy. The nets have been given out free of charge to every household in Ondo State.
Authorities are warning that the nets are not for sale, urging residents to put them to proper use in safeguarding lives. The campaign comes at a critical time as health experts warn of a possible resurgence of malaria driven by climate change and rising insecticide resistance. Blessing Obe, OSRC News.